Hi guys, and welcome to the IV podcast. This is just a little bit of pre-reading for you guys to have a look through before you come along to the session with Fiona within the module. Now during that session, what we've got for you, we've got these rubber arms for you to practice cannulation on. Okay, and one of the things I'll be going through today with you in the podcast is basically the anatomy of a needle and also kind of very basic cannulation technique. In the sessions, Fiona will go into a little bit more detail and give you a little bit more in the way of hints and tips, and also go through how to address the cannula, because I don't have any dressings behind me. Okay. The other thing you have to remember to do is you have to remember to do the test that's on Blackboard. It's just a very brief health and safety quiz. Make sure that you complete it. You can do it as many times as you like until you get everything right. But if you haven't done the test, you won't be able to participate in the practical sessions. Okay? Right, so the next bit of the video is the different bits of a cannula. Okay, so these are one of the cannulas that we'll be using. We'll be using green cannulas, so these are 18 gauge cannulas, as you can just about make out there. As the gauge size gets smaller, the bore size of the needle gets bigger. Okay, so if we pop this out onto the table, you can see it's made up of different components. Okay, so there's a one-way valve at the top there, so you sometimes use that to test injections, test if the cannula is still patent, usually with a little bit of saline. There are a couple of wings there. At the back there's the chamber, and here we've got a luer lock. Now here we've got a sheath which covers the needle, so it's very, very important that you don't wander around the lab with the needle unsheathed. You never pass a needle to another person if it's been unsheathed, because all of those sorts of things increase the risk of needle stick injuries. Okay, so what I'm going to do now is unsheath the needle. Okay. So it's obviously very important that you don't try and put the sheath back onto the needle, because again that runs the risk of increasing needle stick injuries. Now I don't know whether you'll be able to make it out on there or not, but what you'll see sort of halfway down here is that there's a plastic catheter that covers the outside of the needle. Okay, so when you're cannulating somebody, it's not the needle that stays inside the patient, it's the plastic catheter. Okay. So what I'm going to do is I'm just going to see if we can see that a little bit more. Okay, so you'll see towards the end here that is just plastic catheter, and then the needle is up there. Okay. Another important thing you have to remember that when you're cannulating is that once you've retracted the needle, you should never try and push the needle back, because that runs the risk of shearing off a little bit of the plastic catheter, and that could cause an embolus within the patient. Okay. So once you've removed the needle, the first thing you must always do is put that needle into a sharp spin. And that must be done straight away before you do anything else, again to reduce the risk of causing a needle stick injury. And that is the cannula that will reside within the patient. Okay, so you can see an 18 gauge, it's quite a long catheter, and that's why we tend to use it as well for larger bolus injections for the patients, particularly in CT, also because it's wider as well. One of the nice things as well about these cannulas is, if you look at it, it is quite bendy as well. Okay, so the nice thing about this is that if the vein is quite tortuous, then it should be quite easy for that particular for the catheter to track along the vein as well, and also it's got a little bit of bend kind of up and down there as well. But obviously what you don't want is a kink to form within the catheter. So as long as you're not trying to turn it round right angles, you should be all right. Okay, so now the way that you would normally hold a Venflon is like so. Okay, so you would usually hold it with the finger on either side of the wing and with your hand on the back of the lure lock. There, once it gets it into focus, eventually. Okay, but the way I'm going to be doing it is I'm going to be holding the needle a little bit like that so that you are able to see where the flashback points and everything like that are. Right, so once we unsheath the needle, you should never try and put the sheath of the needle back on, because that increases the risk of a needle stick injury. What I'm going to talk you through now is where you would expect all of the different flashbacks to occur. So once you've sort of stabbed the patient, if you like, what you would expect to see is a first flash coming up into this chamber at the back here. And what that means is that basically that the needle is residing within the vein and that blood is tracking back up into there. It doesn't necessarily mean that the catheter part of the cannula is within the vein, and there's a little way of checking that that is actually the case. So once we've stabbed the patient, we just need to turn our angle a little bit and advance a little bit more, and that is what ensures that both of the catheter of the cannula and the needle are within the vein. And by changing the angle, you ensure that you don't get transposition, which is basically where the needle sticks into the kind of inferior part of the vein. Okay. So as I said before, I'm just going to change the way I hold it a little bit just so that you can see where each of the flashes are. It makes me look stupid, this, if it. Just unflick that there. Okay, so it wants to be around about 45-degree angle. And there you can see the first flashback. So change our angle a little bit and advance a little bit more. And then what we will do is we'll just take the needle out. So you can just about make out that blood is starting to accumulate in that chamber there. So that means that we're in the right place. So from there we hold on to the needle and advance the catheter forwards. Okay, and you can just about see that blood's starting to track. See that? Up and through, so we take the needle out, into the sharp spin, and there we go. Lovely job, eh?